CDC is expected to relax some COVID recommendations soon, just as kids start heading back to school.
Among the proposed changes, those exposed to COVID would no longer have to quarantine, but mask for 5 days.
UW Health's Dr. Jeff Pothof is back with us for his weekly visit. Hi, Dr. Pothof. Good to see you.
Good to see you guys.
Before we get into the nuts and bolts of that, the community transmission in Dane County has decreased. Now we're in the medium category.
Right.
So what does that mean for everybody watching?
What that means is that right now in Dane County, we've come off of what must have been a bit of a higher peak of cases and hospitalizations, and that seems to hold true. What that means for people in their daily life is when we were in red, if you were even healthy and you were going to go to an indoor environment where a lot of people were at, you would want to mask to reduce transmission. In the yellow environment, that still holds true for those who are high risk, immunocompromised people, but lessens the need for masking in an indoor environment for those of us who are healthy, vaccinated, things like that.
So let's talk about these new CDC guidelines. If you test positive, you don't have to quarantine. This is a big change.
So if you test positive, you'd still need to quarantine. But if you're exposed at school, so let's say you have this close exposure, we used to take kids out of school for 5 days. This new guidance, it's this compromise between trying to ensure that we provide a good educational experience for our kids, at the same time minimize, disease risk to those children. So, with higher rates of vaccination, with higher rates of natural immunity, with therapeutics available, this idea that folks who are exposed should still take the precautions of masking to prevent spread, but can still be in the classroom and learn, I think is a step in the right direction, especially this far into the pandemic.
And the social distancing guidelines will all be gone. I think the CDC did away with them a while ago anyway. So that's already almost a relic of the pandemic past.
Right. I mean, especially with these more contagious variants, we probably can't distance enough in an indoor space to necessarily get that benefit. So really the big protection comes down to masking if you're in that high-risk scenario.
What does this tell you, all these changes in the recommendations?
I think it's a combination of being in a very different place. I mean, I remember earlier on in the pandemic, we didn't know a whole lot about this. We definitely didn't want our kids getting sick when we didn't know what could happen, and we wanted to keep our teachers safe. Now, with a lot of vaccine availability, a lot of people who recently have COVID, better understanding of these variants and seeing less severe disease, I think you start seeing these changes that try to figure out how do we live with COVID, i.e. provide a good educational experience, not put kids at unreasonable risk, but balance that a little bit better.
So you think it is a reassuring message for parents that it'll be as normal as possible this coming school year?
Yeah, I think it's good for the kids. It doesn't mean we throw complete caution to the wind, but at the same time, trying to get back to some sense of normal is probably a good thing.
And then there's monkeypox.
There's monkeypox.
And that's continuing to spread.
We are seeing more cases. In fact, I think the U.S. is now starting to lead the pack, much like we did with COVID, in monkeypox cases.
Vaccine availability has been an ongoing story across the country. What's the situation locally?
Yeah, I think, if we don't have vaccine in the community, we can get, isolated doses for specific cases. We are getting more doses, but much like the national and international landscape, there is not enough doses available for the number of people who are likely going to be at risk for monkeypox. So they're looking at things like, can we give smaller doses intradermally rather than like the normal injection you expect? Would that protect people until we can build up those stockpiles to vaccinate the way we'd like to?
But this does not spread like Omicron or the flu.
I mean, not even close, like not even like the same game. So I mean, what we're seeing with monkeypox is close skin-to-skin contact is how we're seeing this spread, and we're seeing it spread mostly in social circles where folks are kind of hanging out together, skin-to-skin contact, things like that. So it's not that we're not seeing it sometimes in kids in school or in other cases, but a very different disease than COVID, which is super easy to catch, and all you gotta do is be around people who don't even know they're sick who have it to catch it. That's just not the case with monkeypox.
And you're always looking down the road when it comes to COVID. Are there any other variants that you're hearing about that you're investigating?
None that have come to light. There is this 2.75, Omicron 2.75. So again, another subvariant of Omicron that, is over in Asia, a little bit in Europe, not necessarily making big moves right now. Right now, it's still BA5 right here. But we'll have to see. It would be great if we could have a vaccine this fall that covers BA5 and not have something other than BA5 be the dominant variant at that point.
But a lot of kids are not getting vaccinated. And I mean, is that going to be problematic as everybody goes back to school?
I think you could see more cases. I think, in the kids, the thing that worries me is most kids will do fine with COVID, but some will not. There's even more data now from the CDC that says, kids who get COVID have a much higher rate of things like blood clots and heart inflammation, diabetes. It still doesn't happen often, but it happens more often in those kids who get COVID. I think the second thing in schools, if we have high rates of transmission, is not the kids, but the staff. If we infect our teachers, and our teachers, maybe they're doing fine, they're vaccinated, but they're at home for 5 days, it gets hard to run a school. So I think that's what we'll have to watch out for.
Get vaccinated. All right, doctor, we'll see you next week.
Great information. Good to see you, Dr. Pothof. Thank you.